Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say? I'm here with myself, Dr. Lauren Brindisi, and I have a special guest here, Chelsie Simonelli. She is a licensed social worker and the clinical director at the Relationship Enrichment Center, which is here just outside of Charlotte, North Carolina in Matthews. Hi, Chelsie. Thank you so much for coming on.
Hi, it's great to be here. Thanks for having me.
Of course. I am really excited to talk to you about all the work that you do. You know, I'm a big fan of what you do there at the Relationship Enrichment Center. And we talk about so much here in the office, the necessity for therapy. Really, everybody needs to go to therapy. And a lot of people think about the stigma around that and, what that really means for their mental health and their well-being. And I'm excited to talk to you about a new lens of looking into the importance of going to therapy, especially for people who have been dealing with chronic illness. So first, I just want to get people to get to know more about you. How did you get into this work?
Yeah. So I got into the field in a kind of like in a backdoor way, really. I took a psychology class when I was a senior in high school, and really that felt for me like the first time that I was introduced to something that resonated with me. I really loved learning about psychology, and it just felt like home to me. And in all the other work, academic work, I liked what I was learning in school. I was good at most of it, but I didn't feel very passionate about anything until I took that class. So when I went to do my undergraduate degree, I majored in psychology, and I went to grad school and got my master's in social work. And I always knew that I wanted to work in a private practice. That I just really felt very strongly about that. That was more of just intuition speaking to me, I think. And I've been practicing for about 5 years, and it feels like it's been 15, and how much I've grown. And what I was doing 5 years ago is very different than what I'm doing now. And that's just really exciting.
Yeah. So tell us a little bit about the Relationship Enrichment Center. I love that name and what that really encompasses for you and your team. Tell us a little bit about the clinic itself.
Yeah. So REC is very systems focused. So really what that means is, for an individual, what we're looking at is not just what an individual has experienced, and we're viewing all of what somebody comes in with through the lens of they grew up in an environment. And so we can't take away the importance of that environment in contributing to what somebody is coming in with, what they're experiencing. So looking a lot at the system, which helps us see a broader viewpoint. And in how I conceptualize my work is I need this like bird's eye view. I need to understand the bigger picture for me to be able to help somebody in their healing work. So that would be a major just a major lens or approach that Relationship Enrichment Center has. Our whole team thinks and heals systemically. And then I also love the name because when we think about relationships, most people think about relationships with other people. And a lot of what we focus on is the relationship that we have with other people is extremely important. However, we first have to look at the relationship with self before we can consider relationships with other people. And that is fascinating work. And I love helping people reconnect back to themselves, and learn, maybe even sometimes for the first time, who they are.
That's beautiful. Can you help paint the picture for people who maybe don't understand how the work that you do maybe differs and where it might overlap with a more, traditional psychology or psychiatry route as it pertains to their mental health and well-being?
Yeah. Okay, so most people, when they think about mental health, is just the way our society thinks about mental health is like through the lens of a diagnosis. Um, I don't not use them, but the rationale for giving a diagnosis might be very different. So I think they have their time and place. However, I believe that 90, maybe even 95% of the diagnoses that we give are symptoms of trauma. So what we call anxiety, I believe, is a symptom of something much deeper. What we call depression and ADHD and OCD, like I believe those are all just symptoms of something much deeper happening in the body. And so my approach is very much looking at the root cause of why is somebody experiencing those symptoms. And I think traditionally, what many people fall into when they decide to go to see a therapist or a psychiatrist is they're given this label, they're given a medication, or the work that's done is focused on like the behaviors. And a lot of times people are missing the root cause, which is usually something that happened in childhood. Yeah.
So, what kinds of clients are you often seeing in your clinic?
Yeah. So most of the time, the people who find me have experienced some sort of what I would call developmental trauma or attachment trauma. And what that means is that somewhere along the way in their upbringing, in their relationship with their parents or other primary caregivers, they experienced attachment ruptures. And sometimes those happen very unintentionally on our parents' part. And when those attachment ruptures happen, it creates a story in our nervous system around um, what around connection specifically, but then we create these core beliefs that we have about ourselves. And so sometimes based on those attachment ruptures or early life experiences, we come to believe that we are not worthy of love, or we're not good enough, or we don't deserve good things to happen. We're not important, or we don't matter. And so then that creates a perception about ourselves and the world, and we come to relationships with those core beliefs. So a lot of the time, the clients that I'm working with have these negative core beliefs that they internalize really young, and they internalize them based on a developmental stage that they were in, usually between like 4, 5, 6, 7 years old. And that internalization is skewed because they're viewing their world through the lens of a 5-year-old. And so it's like just misinterpret what's happening around them. They believe things are their fault, and nobody taught them any different. Nobody changed that perception for them. So then they move through their adolescence and adulthood very much believing these core beliefs that they have, and those are the core beliefs that show up in their relationships. So most of the time people are coming in because they have some sort of conflict in their relationships. And then when we go backwards in time, we can really pinpoint where some of these things first started.
I think this is so important for our viewers to really understand and start to grasp, because so many people that we see deal with nervous system dysregulation in a variety of ways. But a lot of our patients are told that they just have anxiety, and it kind of gets, putting the word just in front of that just totally discredits the idea that there's something going on, and it needs to be investigated deeper.
Yeah.
So that's one of the first podcasts my sister and I did was, it's not just anxiety. And this is where the crossover between the things that we do, and I know we refer back and forth pretty frequently, is that in our clinics, we can really look at objective data about what's going on foundationally with their nervous system.
Mm-hmm.
But I describe to patients all the time, right? This idea of duality was debunked a long time ago. So when we talk about neurology and psychology, they're really intertwined because they're both your nervous system.
Yeah.
And there's so many people who either, struggle with their ability to heal because of their relationship with themselves or their relationship with their chronic illness. Or like you said, as I've spoken with you more and I've learned more about the work that you do, is that we see people who you can tell, their relationships in their past, like you brought up, maybe in childhood, or their dynamics in their household, or their current relationships with, money, time. I mean, it can be really anything, can be limiting them.
Mm-hmm.
And so what kind of work are you doing when people come in? What does that really look like? And how does that differ from just a more traditional talk therapy?
Yeah. So I love that you bring up the nervous system dysregulation, because that is so much of what's happening internally at a somatic level that's creating the behaviors or the symptomology that people experience. And so I will work experientially doing some inner child work, and that's addressing like the different parts of us. That's kind of like a big buzzword that people are hearing a lot now in the therapeutic space, is we have all these different parts. So I do some experiential work to help integrate all of these different parts that we have. The thing that I'm most excited about right now is a modality that I'm using called transforming touch. And that's a strictly somatic approach. And what's happening in those sessions is I, as the practitioner, am helping my client to co-regulate. And when you think about these early life experiences that we have, oftentimes we are learning that we have to self-regulate before we have the skills to do that. And so what's supposed to happen is we're supposed to have these experiences of co-regulation with a safe, secure caregiver. When we don't have that, we move into self-regulation. That's really how we learn too young self-regulation, so we don't do it in healthy ways. So in this transforming touch work, we are giving a client's nervous system the experience of healthy co-regulation. We're kind of like uploading that software to their nervous system so they have that. And what that's helping with is recalibrating the stress responses. So when we have to learn self-regulation early, what we're learning is that we're not safe, and our nervous system doesn't know what it means to feel safe in our own bodies. So we stay stuck in a sympathetic response in fight or flight, or we stay stuck in dorsal, which would be fawn or freeze. And the nervous system begins to think that everything in the world is unsafe. It loses its ability to discern between what's actually unsafe and what is safe. So the transforming touch work is helping to recalibrate that, and helping somebody to feel safe in their own skin. And it also helps to heal our attachment styles. So moving out of and not moving out of the non-secure attachment style into a more secure, safe attachment style.
Yeah.
And then I also do some energy psychology work as well, and working at that level, to I guess the best way for me to say it is, when we have those early adverse experiences, it changes us at the energetic level, our energy field. And so when we can work at that level as well, we are kind of taking out the where those adverse life experiences were coded into that energy field. We can extrapolate those and put back in what was always supposed to be there.
I love that. I love the multi-system and multi-modality approach. I mean, that's what we do here in our office. We're using a variety of methodologies to help support the patient's ability to heal and repair their nervous system and create new neuroplasticity, which is exactly what you do,
Yeah.
just using different methods. So for those who are watching this, if they feel like what you're saying is really resonating with them, do you have any recommendations? Especially, we have a lot of viewers who aren't here in North Carolina, maybe won't have access to you, but what other resources, or tools could they start to look into now?
Yeah. I would say that there in our world and in the therapeutic space in this field, it is really exploding with somatic therapies, because what we're learning is we can talk about our traumas till we're blue in the face. We can connect the dots. Everything can make sense, and that's great, and we need that. Except healing doesn't happen up here thinking about it and talking about it. Healing happens when we can move into the body. And so I would recommend a therapist that is doing somatic experiencing is a great somatic modality. EMDR is really helpful. Internal family systems, transforming touch. There's practitioners all over the country that are doing that work. And I would really, really, really recommend people that are moving into the therapy space to address some of those emotional root causes of chronic illness, to be doing something that's going to incorporate their body.
I got to close the loop,
Yeah,
right?
exactly.
I love that.
Do we have time for like just one quick story?
Yeah, of course.
So I wanted to share this because I think this is so cool in the physical manifestations of emotional things. So I am trained in a muscle testing technique, and I've been having this like achy feeling in my wrist and my, very specifically, oddly, a couple of the joints in my fingers. And it's been happening for maybe the last month. And I told my husband, I'm like, I really got to muscle test this to see like what's happening here. And so in one of the test kits I have, I can test for the different bacterias of Lyme and parasites and mold and things like that. So I tested all the Lyme things because I know Lyme can show up in the joints, and it wasn't anything like that. I didn't think it was parasites, but I tested that. And I was looking through the test kit to see like what else that could be. And I tested radiation. It wasn't that. So I'm just looking. And my eyes glanced across the test vial for negative emotions, and I'm like, I wonder if that's what it is. And so I tested that, and that's what it was. And like, so weird to show up in my hands. I don't quite understand that. But then I did some more testing, and I asked some questions of what is the emotion, and I went through a couple of them, and what came back was disappointment. So I have this stored, stuck emotion of disappointment in my body, and I'm sure my body has been trying to communicate to me in other ways that this needs to move, this needs to process. And in all the ways that we can ignore our body's signals, I probably have been doing that, and here it is showing up as a pain in my hand. So with that, right, I can go back to my spaces and process, and get curious about what that disappointment is, and move through that work. And I have no doubt that the pain will go away once I acknowledge that and give that some attention. But isn't that crazy?
That is, yeah. I'm very interested to see how that goes as you start, delving more into, internally thinking about those things. And I love that. I mean, emotions are stored in our body, and we know that, but like you said, we don't always have the right tools to figure that out or navigate it, and we can't always talk our way out of the situation. So to have these different tools that can help cue us and, point us in different directions of things to evaluate and reflect on, just changes this whole world, for people who maybe have gone to a therapist in the past, have been down the more traditional medical route of like, what's wrong with me, right? What is my diagnosis? And then going about a treatment that's actually treating that, instead of this newer, more holistic realm of self-exploration, which I just think is so beautiful. So thank you so much for all the work that you're doing to help people. And I really appreciate you coming on here and just educating everybody.
Yeah, thank you. I love the overlap, the connection between the two, and yeah, just with focusing on both emotional and physical health, people get better so much faster.
They do. All right, we'll talk soon. Thanks again. If you guys did like this and you have any more questions about this category, if you have more questions specific for Chelsie, just let us know. Like, share, comment underneath. You guys are driving a lot of the topics that we are talking about here on our social media platforms. So we appreciate the support, and we'll see you soon. Bye, Chelsie.
Bye.